This segment is sponsored by MD Monthly.
All right, who is this person? Let me give you the clues again. My brother James and I are actors. I played a magician in the movie Now You See Me, and I'm married to actress Allison Brie. Do you know who I am? If you guessed Dave Franco, you're right. Today is his birthday, and he's 33 years old. Well, helping patients find their first breath again. That's the mission of the team behind Pulmonair, an innovative medical device that's helping people with breathing problems. And joining us to tell us a little bit more, Dr. John Raimondo is here with Pulmonair and Jason Lose. It's good to see you.
Hi, good to see you. Thank you for having us.
This is a huge deal. Very exciting news. And I do want to mention that you were recently featured on the cover of MD Monthly, which is fantastic. A great article inside the magazine, which gives you a lot of really good information. But for people who haven't picked up MD Monthly yet, what is Pulmonair?
Pulmonair is a local company here in San Antonio. We're family owned and operated. We started about 2004, and we got to work with the inventor of the ventilator, Dr. Forrest Bird, from about 2008 till present, and he developed a type of technology that actually cleans the patient's lungs out with air. So it opens up their airways. We ventilate the patient, which is really important, but the main thing is we bring up any kind of fluid that's in their lungs up so they can be coughed up or suctioned if they're in the hospital.
So who can benefit from using a device like this?
Yeah, that's a good question. So any patient with chronic lung disease, it's a very broad spectrum of patients. So patients that have cystic fibrosis, patients who have developed emphysema or COPD, that's a big thing on TV now, right? We're seeing a lot of commercials and stuff like that. But all patients with asthma and things of that nature, they all end up with something called pulmonary fibrosis. And that's just basically scar tissue in their lungs. And so this technology is basically like exercise for their lungs while they're when they're sick. And so we administer medications through the device. But what we've done historically has been in the hospitals. So we're in NICUs and PICUs and burn units. Recently, the Shriners Hospital put one of the children from from the volcano explosion from Guatemala on one of our devices. In a few hours, the patient stabilized. So we have all these devices that for transport in hospitals, but what we're doing now in San Antonio is we're launching this into the community because we have a home device.
There's a home device.
Right, and that's where Jason's story comes in with his mother.
And that is absolutely life-changing because I read up on your mom. Let's talk about how your mom was feeling, like what she was going through before she used this device.
Well, so it was 4 years ago that we came across this device, but she'd been diagnosed 5 years prior to that. And so she was in the hospital, I mean, every few weeks, at a week, 2 weeks at a time, and just a struggle. I mean, it was just we were trying to manage what seemed to be a crash landing for her, and it was, every day was torture. And of course the heat or the allergy season would just, it was horrible.
If you imagine, not being able to breathe for a second, you lose your vision, you're dizzy, you're confused. I mean, it's a lot of symptoms that happen. With this device, it has completely changed things around, and she is up, she's active, she's doing different things now.
Right. Yeah, I wish we would have known about this 5 years prior because her life would even be that much more better now. She's very advanced when we came across John and this device.
Well, John, where can people find more information on this product?
Pulmonair.org is our website. We also have a Facebook as well where patients are putting testimonials and stuff like that on there. And Jason's mom's video is on there and explains how when he came to us, the doctors had basically gone to the family and said, we're kind of done. And through a friend of a friend, he reached out to me, and we met at the hospital. And the doctor, Dr. Hernandez, in New Braunfels, was kind enough to move her to a facility where we had guys from the burn unit at Brooke Army Medical Center who were moonlighting there, and so they were very comfortable with our technology, and so they started treating her, and in 12 minutes, her life was changed.
It is amazing. I'm so glad you brought this technology to us here on San Antonio Living and in San Antonio. You can read up on it in the April edition of MD Monthly, and of course you can find out more online. It's pulmonair.org or call the number on your screen, 210-923-9500.